If you want to die early, try being obese. Obesity is not just a cosmetic issue but also has severe consequences for your heart health. The excess fat in your body can impact the functioning of your cardiovascular system, putting you at risk for various heart diseases. In this video, we'll discover the cardiovascular consequences of obesity and understand why it's important to maintain a healthy weight. So, let's get started. What is obesity? Let's start with the basics. There's a difference between being overweight and being obese. Being overweight means having a higher body mass index, BMI, than being healthy. At the same time, obesity refers to excess body fat. Obesity has become a global epidemic in recent years, with numbers rising at an alarming rate. In fact, according to the World Health Organization, WHO, worldwide obesity has nearly tripled since 1975. So, how do you know if you are obese? As mentioned earlier, BMI is used as a measure to determine whether someone is obese or not. A BMI of 30 or higher indicates obesity. However, keep in mind that BMI may not be the most accurate measure for everyone. It does not take into account factors such as muscle mass and body composition. In the early days, people used to think that obesity only affects one's appearance and self-esteem. But with more research, we now know that obesity has serious consequences on our overall health, especially our heart health. Impact of obesity on the heart. Being obese puts extra strain on your heart as it has to work harder to pump blood throughout your body. This can lead to high blood pressure, which is a major risk factor for heart disease. Obesity can have three major consequences on your heart. First, did you know that being overweight can goof up your cholesterol levels? Cholesterol is a waxy substance found in your body, and there are two types: the good guys, HDL cholesterol, and the bad guys, LDL cholesterol and triglycerides. Now, when you're overweight, it's like inviting more of the bad guys to the party and telling the good guys to take a hike. HDL cholesterol, the good guy, is like a cleaning crew that sweeps up the bad cholesterol and helps keep our hearts ticking smoothly. So, we want more of them around, right? However, obesity can decrease the levels of HDL cholesterol and increase the levels of LDL cholesterol and triglycerides, putting you at risk for heart disease. Secondly, being overweight can make your blood pressure go up. Think about it like this. Your body needs more blood to carry oxygen to all its parts. This means your heart has to work extra hard to pump all this blood around, causing your blood pressure to rise. High blood pressure can sneakily lead to heart attacks, which, sadly, are more common in people who are overweight. Lastly, there's this not-so-fun fact. Being overweight can increase your chances of getting diabetes. Diabetes is a condition where your body has trouble managing its sugar levels. The American Heart Association tells us that almost 68 out of every 100 people aged 65 or older with diabetes will also have heart disease. And those with diabetes are 2 to 4 times more likely to have heart troubles. However, some good news. Diabetes is one of the 7 major things you can control to prevent heart disease. Becoming fit, healthy, and reducing risks. Guess what? You can absolutely take control of your health. You can lose extra weight, become healthier, and lower the chance of getting a disease like heart problems. If you're someone who's struggling with excess weight or anyone in your family has had heart problems before, there are 2 main things you need to focus on. The first one is to move your body a lot, like playing a sport, riding a bike, dancing, or walking. The second is to make sure you're eating good, wholesome food that keeps you energized and strong. It's always a good idea to speak to your doctor or a nutritionist to help you figure out the best diet and exercise routine that fits you in your current health situation. Just working out and eating right might not be enough for some people to lose those extra pounds. Suppose your doctor measures your BMI, and it's more than 35. In that case, they might suggest a special type of bariatric surgery. Don't worry, it's a safe and proven way to help you lose weight and even helps with issues like high cholesterol, high blood pressure, and diabetes. Remember, the goal is always to become healthier and happier. Bariatric surgery is also an option. If someone is thinking about getting this surgery, they usually need to visit a heart doctor, who is also known as a cardiologist. This is what we call cardiac clearance. Now, why is this important? Well, if a person has heart problems like high blood pressure or high cholesterol that haven't been checked or treated, it can make the surgery more risky. Things could go wrong during the surgery or even after. The heart doctor helps keep track of blood pressure and cholesterol and checks for any other heart conditions that could cause problems. But the health journey doesn't stop after the surgery is over. It's really important to continue eating healthy and exercising regularly. People who've had bariatric surgery need to make sure they're getting enough protein and exercise so they lose fat, not bone or muscle, including our most important muscle, the heart. Keeping up the right diet and exercise routine after the surgery can help keep your heart strong and healthy. And guess what? It also helps to keep lowering the chances of getting heart disease. The obesity paradox. Did you know that being overweight isn't always bad for your health? It sounds a bit weird, but it's true. Even though being overweight or obese can make you more likely to develop heart and blood vessel problems, here's the twist. If you already have some of these health problems, being a little heavier might actually give you a better chance of getting through them. This surprising situation is known as the obesity paradox. There are many heart diseases where this obesity paradox pops up, like heart failure. Heart failure can happen quickly or slowly, but either way, a heavier person might have a better outcome. This also happens in situations like heart artery disease or when you have a heart attack. Even in cases of high blood pressure and a heart condition called atrial fibrillation, having a few extra pounds can sometimes provide a surprising advantage. Scientists looked at a bunch of research and added up data from 28,209 patients. Over about 2.7 years, they found that if someone with heart trouble weighs a bit more than what's considered healthy, their chances of dying were 16% less. Plus, their risk of dying from heart-related issues was 19% less than people who weigh what is considered normal. But here's the crazy part. If the person with heart trouble was even heavier, what we call obese, their chances of dying were a whopping 33% less. And their risk of dying from heart issues? It was 40% less than those with normal weight. But remember, it's always important to aim for a healthy, balanced lifestyle. This paradox doesn't mean it's okay to become obese if you have a heart condition. It just means that even if you are overweight or obese, making healthy choices can still make a positive impact on your health and reduce your risk of heart disease. If you like this video, make sure to give it a thumbs up, subscribe to the channel, and share it with your family and friends. Stay tuned for more informative videos on health and wellness. See you next time.